Okay, so let's go ahead and call to order our Board of Health meeting for July 2023. We'll begin with approval of our agenda.
I would make a motion to approve the agenda as presented.
I'll second.
So moved and seconded to approve the agenda as presented. All those in favor say aye.
Aye.
All opposed? The motion carries. Next up, we have approval of our minutes from May's meeting. If you had a chance to review those, I would entertain a motion.
I would make a motion to approve the May 23rd, 2023 minutes as presented.
I'll
Okay.
second that.
It's been moved and seconded to approve the May 2023 minutes as presented. All those in favor say aye.
Aye.
All opposed? Motion carries. And just a quick housekeeping thing, we're a little bit behind on signing our minutes, and so I'm also gonna pass around March's minutes to be signed, as well as our resolution from January that establishes our meeting schedule for this year. And so these were things that were already approved and documented, but just didn't make their way around for signature. While we're doing that, we can move into our health officer report. Dr. Gardner?
Good afternoon. I heard an echo. Can you guys hear me okay?
Yep.
Yes.
Wonderful. Well, hello, and thank you, Chair and Board of Health members. I'd like to start off my report by giving a few thank yous. I'd like to start off thanking Mason Health for their partnership in both testing and treating folks with TB in our community. They have worked on educating providers and developing a protocol for testing and treating, which we really appreciate their hard work in that arena. I'd also like to extend a thank you to PCHS. They have actually been working to fulfill our Hep C free Mason County initiative. It's been underway for almost a year now, and they've been educating their providers about treatment of Hep C by primary care providers, and we really appreciate that as well. And then, as many of you know, North Mason Fire has been really active in creating innovative plans for how to bring services to our community. And to that end, I applied for a health equity zones grant in order to try to bring some improved translation of our folks who speak Mam and Conjabal, which are Guatemalan languages. I did not receive that grant, but North Mason Fire is in the finalist group for their grant to bring primary care to people by EMS. So we're wishing them good luck and hoping that they will be able to get that grant. Moving on from our TB and Hep C, Dave Wyndham and I have been talking for quite some time about whether it would be helpful for us to fill some gaps in our community's health needs by directly providing services. This would be a big leap for us, and I bring it to the board because I am hoping to have your approval and support for going ahead and providing direct care services. We are still very much in the planning stage, but I just wanted to set the table, if you will, and see if people have questions about what that would involve. One way that we are trying to fund this is through the hard work of Christina Muellershin and Melissa Casey. We've applied for the Syndemic grant that's offered by the state of Washington. It would bring us enough money to easily fund those services and to purchase a mobile van. What we see as the big outlay is the purchase of the mobile van that we would be using. Right now, what we're using for our syringe exchange is a really old vehicle that was due for retirement some time ago. So if we are able to get these funds, that's how we would like to use some of them, is to purchase a mobile van and provide not just syringe exchange services, but as long as we already have people out in the field, to provide Hep C and HIV testing, treatment for Hep C, and screening treatment for tuberculosis. So I hope I have your support for that, and I'll entertain any questions that you might have. We see this as a really nice way of filling some of the gaps of care in our community. that's the main point that I wanted to get relay to the Board of Health. Does anybody have any questions for me?
I'm for it. Thumbs up.
So the funding doesn't actually become available until January 1st, so whenever we get the notification, that's when the planning will start in earnest. The vehicle will probably need to come out of the TST fund. We have funding in the treatment sales tax fund for the vehicle. The rest of it would be all around the operation of the vehicle.
I think one of the things, oh, go ahead, Dr. Gardner.
And we're hoping that if we don't get the grant, that there would still be some ways to fund this and move forward with it. We see the gaps as not really being able to be filled in other ways. But of course, if the Board of Health has other suggestions of how to fill those gaps, we have a working list of what we see as the needs and what we could do to fill them.
Great. The only thing I was going to mention was, and I've had this conversation with Melissa and Dave, but as we are successful, which I'm optimistic that we will be, I think our application was really good, is we're getting into this direct service provider role again, where we haven't really been in that for a long time in public health. And so just being mindful of all the other things that go along with that, billing and credentialing and things like that, that just aren't part of our current book of business. And so just being able to factor that into your startup costs and making sure that we have staff that have that skill set, because medical billing is its own art and science.
You're absolutely right. That's why I wanted to bring it to you today, is just to build in some lead time. Thank you, commissioners.
Yeah, absolutely. Anything for Dr. Gardner? Okay. Thank you.
Good to see everybody.
You
as
too.
well. Moving on to our administration report, Dave.
Lots of stuff. So I'm gonna start off with kind of the easy thing first. We're looking at some software, and Melissa and I have been through the presentation on the software. IT is we looking at this week, right? Tomorrow. And finance. So what this software will allow us to do is to it's a grant management software. So it allows us to pull down our grants and manage those grants to include all our deliverables, all of our payment. So each staff person who's involved in a grant will be able to see live what their grant status is, how much money they have left in the accounts, those sorts of things. It also allows us to, on the grants that are passed through, allows us to manage those in a way that all the invoices are the same, all the contracts are done the same, and it all goes through the same process, and it will make it a much easier thing. And the engineer who's working on this software was a Munis engineer for years. So we think it should be able to integrate into the Munis system. So Melissa and I have looked at it from an operational point of view. We love it. We looked at a number of other software companies. In fact, I subscribe to a company that helps you look for software. So you talk to them, you have an interview, you talk about what kind of things you're looking for, and they start reaching out to companies and start setting up appointments. And this is the one that's currently coming to the top of the screen. Looks like a good piece of software. So we'll see where it goes from here. But it would like almost like codify how we manage each of our grants. So I think it'll make it a lot more standardized for staff and kind of institutionalize the knowledge in the software, not in the people necessarily. So if you have somebody who leaves, the knowledge doesn't leave with them.
Is this shareable with other departments? Will it have modules where other departments can maybe buy in?
Yeah, exactly. And he asked, so would the sheriff's office be interested in managing their grants through? I said, so well, we can ask, we can be the beta, test it, and see if the other ones. I mean, Munis has a grant piece, but really it's just about the bars lining and setting up the funding cycles. It's really not about how do you actually manage the grant. So yes, the short answer is yes, we can push it. Public Works, Sheriff's Office, other folks.
Well, we're going to want to ask that question at the end and get some numbers, if you don't mind,
Yeah.
doing a little extra work on that and get us those numbers for
Yep.
other
Absolutely.
things we're looking at.
Also have a conversation with the IT steering committee.
Yeah.
and TJ.
Yeah, so that's where we'll have them look at it tomorrow, and then they can elevate it or give me an idea what my barriers are gonna be. So, just get the IT crew to give me a quick screen first, to see if it's even worth, bringing out, so. That's one of the kind of the cool things. Talk about finance, we just signed the consolidated contract amendment 13 last week. That's $1.37 million that's coming in. That has a switch that turns it off and on. For 1.2 million of that is Foundational Public Health Services money, FPHS money. And Casey and I had to do the yearly report on FPHS. Once that's submitted, then that turns the switch for that funding on. The rest of the con is reimbursable, so we can access that now, but the FPHS funding we can't access until that report is finished and sent up to OFM and it's recorded. So then we're getting our funding through FPHS. We're talking with Westfall about how do we do this, because the problem we have is there can be a lag, and I mentioned it in my letter, but there's a lag that last year they didn't get the contract to us until October, November. There was a huge lag, so we had plenty of COVID funding, but that's not the case this year. In fact, we have 0 COVID dollars. COVID dollars were shut off June 30th, done, no more. So we're looking at, is there a way we can run this as a 13-month contract, as a 26-month contract, some way of doing some rollover so we're able to keep funds flowing while we're in the transition period of getting it through the legislative process and getting the review of the previous year's deliverables done.
Because
So,
that happens every year.
yeah,
So what do they expect you to do for a month or two?
right. And they said, well, you can back bill. Well, that's fine on a contract where you have reimbursable. But when it's cash and you haven't received the cash, you can't back bill to cash that you have not received.
Mhm.
So we have to have those contracts in hand and have them turned on before we can do that. So great ideas, little tweaking. So we'll keep moving forward with that. I just got in Amendment 14. Amendment 14 is really small. There's not much in it. So that's one I'll just be able to sign and keep moving on. There's like $500 for this and $560 for that and $5,600 there, just little pieces of work. And then later this summer, I'm expecting also in August, the second piece of the FPHS funding. It's another $0.9 million that should be coming to us, and that's a lot of new lines of work. And there's some brackets in there, so that'll definitely be coming back to the county commissioners to get approval on that piece before we move forward with some of that spending. So Casey and Melissa and Ian and I will be sitting down for a retreat here when we get the statement of work. Once that statement of work comes out, then we can sit down and start planning, how much of it do we want to use? How much are we going to say, this is just not something we can access this year. And then we'll bring it to the board from there. And I expect that to be in Amendment 15. COVID dollars are done, as I said. Not much to report there. We are having a little bit of an uptick in COVID right now in the community. So pharmacists have seen it. I came down on Sunday and got COVID tests out for folks. So we'll be.
But is it shifting around anymore to where, this new strain is gonna do this and this new,
Yeah, so this new strain seems to be a lot of sore throats, a lot
Yeah.
of that kind of stuff.
the mellower things, we're not seeing any,
We did have a death last month from COVID.
Is it like a 10% increase in hospitalization? I think that's what I heard, but I don't know
Yeah.
if that's nationwide
Terry
or not
back there.
necessarily.
So, yeah, we've had a couple of hospitalizations.
Yeah,
So, and we had one death this past month to
okay.
COVID. In fact,
But they have been doing the antivirals pretty,
right.
Paxlovid
Yeah,
is
and-
Yeah,
available.
Paxlovid, yeah. So, and I can tell you from experience, it works. It's nasty,
Yeah.
but it works.
changes their whole taste, but
Yeah.
yeah, it's better than dying.
Yeah, it's pretty bitter, but yeah. In this new contract, we do have a bump to maternal child health block grant, which we've not had a bump to in, I want to say 12, 13 years or more. They've been giving us the same set of dollars, $67,000 a year for over a decade with no increases. This is not a lot, big increase, but it's at least something. So,
Now you can do the same thing and have a Coke.
yeah, exactly. We get fries to go with it. So, so that's a help, and that's through Elizabeth's Term Child Health Program. So that's, like I said, it's the first time we've seen any increases in that in a long, long time. We have sent out some mini grants. We've had 4 requests so far. 2 have been approved on mini grants. Those are up to $1,000. So those are starting to get heard about, and more applications. I had another application or request this afternoon. We did do a $10,000 grant to the Hub for their medical library, where they wheelchairs and canes and all that kind of stuff, beds and stuff. So, and the grant pays for the maintenance and purchase of new pieces of equipment. So they just keep turning that.
I know,
money
that's
around.
where I always send people if they come in and say, well, do you know where I can get it? Yeah, the Hub.
And they take care of a lot of people. You'd
Yeah.
be surprised, and
And it does revolve.
your help couldn't have come at a better time with a campaign they were trying to work on to make
Right.
things happen. You basically stepped in and really lifted them up, so thank you for that.
Yeah, so they're good to go for a while. We've been working with Blue Zones. Blue Zones has been tougher than we had figured. And Commissioner Schutte and I were talking about this this morning or yesterday about Blue Zones. It's all about coming in and getting the community to be interested in wellness and be interested in doing those things where they get more longevity. And what I'm seeing, and what I brought up to Blue Zones last week, was 10 years ago would have been so easy. People were involved, people were ready, people were wanting to do things. Post-COVID, the culture has changed. And it's much more difficult to get people to join groups, to do things as groups, to do forums, to be involved in the community, and that's just the culture has changed. So that's going to be a little tougher nut to crack now with that effort going forward.
People got used to staying home.
They did.
And they want to stay home.
Yes, they did. And they don't want to join groups, and they don't want to get together. So,
Yeah, but think about leading that through North Mason, because every time we do something there, they still show up. You know, granted, it may not be that
Maybe
they're,
with masks.
it may not be that they're always, gonna be able to continue stuff, but right now, no matter what it is, when we do ask them, they come out in
Yeah.
large numbers.
we had a open house around built environment, infrastructure in the built environment. We had 6 people show up. So it's, people just have, and when we had the food open house, we had 3 people showed up.
Yeah.
So it's messaging is going to be much more difficult than it was pre-COVID. So that's going to take a lot more work. So you'll be hearing more from Blue Zones folks. And then we have Mason Matters, which is back up and rolling again. We've got a contract that's going to be coming over for the county to sign off on. It's the same contract we've had for years, but we needed to update it, where we contribute $25,000 a year to Mason Matters for their work. The hospital also contributes. I think North Mason Hospital District contributes.
We didn't because of what our lawyer had said to us.
Yeah.
So if it's something specific to the North Mason area, then we can,
Okay.
but it has to be really specific.
Okay. Okay. Well, I'll bring that up on Friday at the Mason Matters meeting. So we do have some efforts going forward around Mason Matters. The forums are starting to work. We had a forum meeting this month, which was well attended, broke up into different groups. My group was the access to healthcare, so I sat down with folks from the hospital, from PCHS, and talked about all those things from North Mason, what's going on in North Mason, where are the gaps, what keeps people from coming in, South Mason, Hoodsport, look at all those places to see about how we're doing for access to healthcare. There are other people who are talking about equity. I mean, there's just a number of groups working in the room. Housing, transportation, behavioral health,
healthy living.
right. So a number of groups getting more and more active, and we're going to keep them involved. And And that's kind of falls along the mini grants idea. Mini grants is just kind of a beta project right now, but if we can get those forums, those groups doing things, we have the ability to use FEHS money that we would normally be sending back and let groups do some of that work and fund them to do the work. I think it's a better idea. They know what they need and let the community decide how we move forward. So that is going to be the focus you'll be hearing probably throughout the fall. Financially, otherwise, we look good. We've got funding. We're not really losing any positions. We look good this year, which is nice to be able to say that. So,
That is good.
And nobody's leaving. It seems like
it's
we have an
been,
exodus.
well, we've actually hired several people here in the last, well, we have one
Yeah.
left, but, and we've rehired that position, so.
Well, that's good.
um,
That's what I like to hear.
We had an interesting group of applicants on Friday, so we are getting more applicants, and we're getting more applicants from across the nation that are looking to come out here. And I really think that the contract negotiations that happened and bumped us up to a little more of parity on the environmental health side of the house especially, is helping us recruit people.
Good.
Great. Anything for Dave? All right, thanks, Dave. Next up, Ian, environmental health.
Well, I have 4 relatively new staff, all in 6 months. And then I have a new person that's going to start on August 16th in our water quality program. So we'll be back to 2 people. So, yay. He just accepted today, just earlier today.
All right,
And
good
he's
news
coming
for our
from,
clean water district.
yeah,
Yes, it is.
yeah, very good news. And he's coming from Thurston County. So we're stealing someone from Thurston County, amazingly. I know, it's like.
That usually
blew my
goes the
mind.
other way, doesn't
Yeah.
it?
Public health.
It always goes the other, it blew my mind.
And I need to steal somebody back from ecology, so.
And, yeah, and his job he's doing now is almost the same as the job he'll be doing here, so. He has 5 years of experience there, 8 years total as an environmental health specialist, so. We don't often get applicants that are that qualified, so.
Well, let's hope it's a good thing. I had a company I was working with once. I've always hired every Eagle Scout I can get my hands on. I one time chose not to hire an Eagle Scout because I had a Harvard person that had applied. I hired the Harvard person over the Eagle Scout and found out that there was a reason why the Harvard person applied. So just know that that's something I've never forgotten in my entire life.
Yes, I don't know if Thurston County is the Harvard person, but, yeah, only time will tell.
Yeah.
Just double check, that's all I'm saying.
That's why I have a probationary period.
Yeah.
Yeah.
Yeah. But so that's very exciting. At the same time, it's, lots of training that has to happen for that many new people. But it is very exciting. There's not much else that's been going on that's super exciting, but today I do have an item to discuss with everyone, which is a permit policy change. And Terry King is here today to speak about that, I believe. And Terry, are you representing Sea Grant, or are you just assisting them as far as?
Are you still with Sea Grant?
Yes.
Wow,
Diana and I were just speaking, over 40 years I've been
yeah.
here. Wow, it's a long time. No, not, just as a person that serves on the, I watched the on-site advisory committee. I was a longtime member of that committee when the rule that's actually being changed was put in place. And a member of the Clean Water District, so I just have some concerns, but would like you guys to be briefed and make your decisions, and if possible, if I can make a comment, that would be great.
No issues, no issues.
Yeah.
Great. When we
I'd
get
love
through
to hear
Ian's
that.
report, we'll,
Perfect.
yeah.
All right, so I'm gonna share a screen so everyone can see the draft regulation. But just so, for some background, and Terry, as she said, probably has even more information on the background of this policy than I have. But up until, prior to 2019, the permit policy for Mason County was you apply for a permit and it's good for 3 years. And then at the end of that period, before it expires, you could apply for an extension to your permit, but it was only good up to September 30th. Essentially, catching things before it would go into the next wet season. And then in 2019, the OSAC committee had voted to change that policy again and to allow for a full year extension beyond the 3 years. So the state WAC currently allows 5 years for a permit. Mason County is more stringent than the state WAC. And during the previous OSAC meeting in June, one of the designers brought up a request to change to allow more time for people to get their permit installed. Some of the reasons that she had stated was issues with financing that some people had, and just a lot of issues in the industry right now causing projects to take a lot longer. We discussed it at that meeting, and we came up with some of the changes to the policy that you can see there as far as what the designers have to attest to or sign off on when they're allowing one of their designs to be extended for an additional 2 years. But the proposal is to allow someone to essentially have a permit for the maximum 5-year term, which is consistent with the state WAC. And we came up with those bullet points to ensure that there's no issues with the site that would change over that time period that could cause that design to not be a viable system that would properly protect public health and surface water.
So if they attested this and it's not accurate, because some of this stuff is not gonna be within their, their little bubble, somebody does something, changes something on adjacent property close to it, what happens?
Well, they have the ability to fully research that. It's not something that would, unless someone secretly drilled a well inside their house or in their basement or something.
It's happened.
There's all kinds of things happen.
The old Griffey store, it's still there, right?
Unless someone did something illegal, which that can affect anything, whether they do it illegally before the system is installed or they do it illegally after the system is installed. Everything that is in here, a septic designer can verify and research, and knowledgeably attest to that.
So we're telling them they must re-verify then,
Yeah.
is what we're saying.
Mhm.
Because just attesting to it doesn't, that's
Now, does
day
that
and
get
age.
flagged in SmartGov?
Hmm?
Do we put a flag on that in SmartGov, so there's
A flag to say,
that's on an extension?
yeah.
Yeah.
Yeah, they have, there's an extension fee they pay.
Yeah.
It's a whole
So
process.
so
There's an
it shows up in
application.
SmartGov then?
I'm sure there's a hand up,
Yeah,
but
it's
it's noticed, okay.
Dr. Gardner?
Thank you, Chair. Ian, this is just for the design. This does not mean that somebody has a septic that is out of compliance, they can apply for an extension. This is just for the design that's not being used. Is that correct?
Yeah, this is for a new system, so if someone wants to install a new system, they'll have essentially up to 5 years to install that system. 3 years and then an additional 2 years if they pay a fee for a review and an extension.
Okay, thank you, Ian.
And you wouldn't require another inspection by you to change the.
It does not
check
require
this-
another inspection by us. It does require an inspection by the designer because they have to go out there and make sure that the site conditions are still consistent.
You might want to include those words, because that comes back to what I was just talking about. If you don't actually say it,
Mhm.
it just,
Yeah. Yeah, it's our intention, the form that they're gonna sign is gonna say, I am, essentially under my design, because they're state licensed, designers are. They're, under the purview of their license, they're signing and testing and stating that these conditions are true, that there's been no changes to the site that would impact the drain field or the reserve. There's been no, contamination issues or things that could become contaminated, like wells being drilled, on either that property or neighboring properties. And if there's something that I've missed or an extra bullet point that could be added to make things more clear, happy to add it, but I ran it through the OSAC committee to
Mhm.
see if anyone there had any additional comments, and all they said was, we only got one comment back, and that was that they wanted people who currently had permits to be able to take advantage of this and they wouldn't be like stuck under some old system. I said, no, that would not happen. You would be stuck under some old system.
Not grandfathered in.
Yeah, reverse grandfathered into a negative, so it's like, you're grandfathered, so you can only get 1 year. No.
Any other questions or comments from board members before okay. Terry?
Yeah. I want to thank Ian and his team, and I know how many holes he's had, and I'm so excited to hear about your 5 new members. That's
Thank
awesome. And I mean, I really am, because I've been hiring a lot too. My concern with this proposal is, the state law is going to be changing soon, which means county code is going to be changing soon relative to onsite. We've been waiting, COVID happened. There's some new things that are going to be in that code that we probably are not going to want to grandfather into somebody with a 5-year extension, or a 5-year permit. One of the reasons that I remember when I served on OSAC that we had not gone with the state level was because of our amount of water quality degradation. And we needed a tighter rein to make sure that people didn't have so long to do something, and that we got it in a timely manner so that it was meeting the current rules and regulations that the county had, instead of being expanded and being speculative. So you'll find that people will apply, they won't put it in until the very last day. What the county found at one point was it was causing financial issues. Somebody pays for a full permit on day 1 and executes it on year 5 at the very last day. That money isn't there, we've already spent that money. And then we have problems getting resources to those situations. They've already paid for it, and they deserve it. And one of the things that the county looked at the time was, could you hold back money into a special fund that would only be expended when a permit was being fully, executed? And that was one of the big challenges that we had during those years of the county when we had shortfalls. So, Commissioner Netherland and Commissioner Schutte put in some interesting language, or some things to remember about, and it goes to, we have designers that are getting older and they're passing. Some of them have recently passed, and so what happens to those folks? Are they not going to be allowed to get an extension because the original designer is not available to them? So some of those could have it. The thought that you can get a permit renewed after it's already expired, is it a year past due? Is it a day past due? What is that time? Could it be 2 years past due that they would renew? Because that's really vague in what I'm reading in this. One of the other things is sometimes house plans change, or what was designed and originally going to be put in was fine, but then they changed the house. We're looking at an old onsite, an old plan for something that now has even more footprint within the house, or more water use that wouldn't necessarily be good for this system. So, county and state regulations are going to be changing soon. When this was brought up on the agenda, it wasn't on the agenda. It was an after-the-fact, round-the-room thing. There really wasn't data provided. Only one person spoke to this as a need, and I'm wondering if we're changing a rule just to satisfy one condition instead of doing a variance or a 1 or 2 thing, and that we're not opening a bigger problem. And to that end, there was, I think, 1 or 2 watershed folks. The shellfish industry wasn't at the meeting, and I would just like to see this body refer this to the Clean Water District for briefing, so that the Clean Water District can better understand, because I think OSAC and the Clean Water District do have overlap, especially where it comes to clean water, that we can both benefit from. And if it truly is a need, and we're seeing it all the time, then yes, we maybe need to do something. If this is a one-off, probably not. And how does this relate to the OMP that Ian's going to be writing, the operation plan, and also our marine recovery areas that we have? How does all that play into this language?
Great.
So thank you for hearing me. I appreciate it.
Yeah, thanks. Constance or Louis, anything?
No, I mean, Terry just brought up some things that I hadn't thought about. There was, for me, I didn't vote on this because it wasn't on, it was just, I didn't have enough information, so I'm here today, and I'm glad that, that I'm hearing some different things, but there are, like, in the Alderbrook area, in that subdivision, I believe you live there, there's, I downloaded, there's about 33 lots owned by Alderbrook Properties. And so is this a situation where somebody's gonna come in and write plans for all those 33, and then we're back in this thing of their septic ready like we used to do before, and then it's just extension after extension, and it all gets kind of muddled, and then nothing ever happens. So that is a concern, because we used to have cable ready, septic ready, you know, for 12 years, a little sign out on that thing, so. That's what I was concerned about.
Any additional board discussion or direction? Commissioner?
I definitely think that we do have to pay attention to one of the pieces that she had mentioned there. When it comes to, another question has beyond there, has the design changed since the original?
Are you talking about as far as the intention for the house?
The building or whatever?
So that is already something that is a problem currently. Well, it's not a problem. It's something that's already addressed in our current processes right now, and it's not a problem. When someone applies for a building permit, they have to get an environmental health review. And when their building permit is approved, they have to have an adequate septic system installed, and they have to have an adequate water source. So currently, if someone puts in a septic system and then they decide they want a 4-bedroom, 3-level, whatever, and they only put in a 2-bedroom system, at that time, they're forced to upgrade that system to meet the requirements of that 4-bedroom house.
And the same for setbacks and the like, because that's what would see in my head that would occur.
Yeah.
They changed the design, decided to move the house, which, as you know, happens all the time. And they decided to put it closer 4 years afterwards.
Yeah, it's the same thing, it's the same issue. And people have that challenge all the time. We tell them, no, sorry, you have curtain drains in this house. You have to have curtain drains in this house, and you can't put that closer than 30 feet to your drain field. And it causes them all kinds of heartache, but that's issues with them, planning out their project. But it is something that does not get missed. It's something that is accounted for.
And if you can assure that that's not gonna happen, then I don't have a problem with it. But the other thing I would also still say is somewhere there needs to be a checkbox or something asking or requesting, have you visited the site since such and such? Because if things change and they haven't visited the site, they're just gonna stamp it or check the box from Seattle without ever coming out to see that nothing has in fact changed, because that's just what they do. And what are we gonna do about it if they were wrong? Nothing.
I mean, the majority of our designers live in the county. The vast majority of them do. We have a few that come in from out of the county, but I would say 90% of the systems are from in-county designers. But we can easily have in that statement, I swear and attest that I have visited the site, or I've inspected the site, and have ensured that the following
None of these.
conditions.
That's all I would require or request. I don't require nothing, I'm just one vote.
Dr. Gardner?
Thank you. I was just wondering, Ian, is there any urgency to this, or I thought the previous speaker's points were well made. Is there any reason not to have further discussion on this or take it to the Clean Water Board?
There's no reason not to. There's no urgency that I know of. This is, like Terry said, it was an item that wasn't on the agenda, but the committee decided to move forward with it. And the committee was, for the most part, in favor of it. Everyone voted yay, or, Constance had abstained. But there's not an urgency on it. I've already, in certain extenuating circumstances, granted, as Terry said, a waiver to our policy requirements for people to allow them to get an additional extension. So that's already something that I'm doing, because people have all kinds of circumstances that come up in their life that are traumatic or catastrophic.
I guess my preference would be to get that input, but Chair, thank you for taking my comments.
I don't mind that that much, but what I do always have an issue with is we have processes, and if we have a committee that's already doing it, it needs to go through that committee, and instead of sending out to other committees to come back. But because it wasn't announced, they probably should put it back on the committee agenda again and allow for these other folks that are members of these other groups to be able to come and testify. That's probably what I would request to help get us to a negotiated working decision. But I don't like the idea of taking it and having to go through a different group and then have them okay it and send it back. I'm not a fan of that. You already have one that works.
Just out of curiosity, and you might have to do a little bit of research on this, but since we made the last round of updates, can you tell how many applicants have taken advantage of the current extensions allowed under the code, and then how many of those have lapsed? So thinking about how many, what the gap between who's taken the extension and what the number of people who might benefit from an additional extension might be.
Well, it wasn't a huge difference, because it was basically 3 months, or 2 months, 3 months? Yeah. So it wasn't a huge difference in time. I couldn't tell you what the numbers were off the top of my head, but everyone that applies for extension gets a full year now. It's not like they're choosing, one or the other. And we have many, many permits that just never get installed and lapse. It's just a natural part of the industry, that there are people that start off with projects, their financing is good, and then their financing falls out, and it falls off, and then it might be 7-8 years before they can, restart that project again, and they come in and they have to do a full new design. They can still use that old design to some extent if they can find that designer and get them to issue a new application. But it's just a natural part of the industry that there's designs that never get installed.
Yeah, I guess I'm just curious as to, so I'm good with this going back to the group and having it published on the agenda to allow a little bit more discussion and dialogue at that group prior to our taking action at the Board of Health. But I'm just curious if this is a solution in search of a problem. Are we really seeing this, a high level of demand for extensions beyond what's already allowed? If like you're saying, there's a lot of, this is pretty common where these permits lapse and there could be several years in between. I'm not sure, what segment of the population we're actually serving by extending this even further. I think there's probably some merit to it because it's in the state administrative code for the 5-year allowance, but I just don't really have a good sense today of what the percentage of the population actually would need this or want this. So
I can share with you that it has more to do, I've seen over the years this have a value in real estate. When the downturn in the economy's hit and they're held off, that's where this would come in. When it comes time they can't build anymore to be able to sell the property, the viability of that permit has a great impact on their ability to sell the property. Absent those, they can have that permit. If it's lapsed, it means nothing. And so therefore they lost the ability to capitalize on their investment. But you see it more, like I said, during downturns. We haven't had one for some years, but it still could happen anytime.
But then we also just had a really large increase in cost in building, so
Yeah.
there were a lot of places that just stopped. Like,
Yeah.
my daughter just stopped for
Yeah.
a year.
Yeah.
She still has her septic in though.
Well, and then is there a way to, Terry brought up a good point too, is the original designer. So I could
That's
see it
a-
if it was a firm or something like that, it would be easy to maybe find that designer. But is there a way to take out maybe original and just say certified?
The reason why we require the original designer is that is a WAC requirement. The WAC requires the designer. We can grant them kind of a variance, and technically it's not okay with the state WAC to do this, but the state has kind of blessed it as not something they want us to do a special waiver for. Where if there is an issue with a person who's working with a designer, and this comes up all the time, there's falling outs that happen between people that have some business relationship, and they can't work with a designer anymore, or a designer dies, or a designer retires. This happens all the time. If the property owner writes us a letter and says, I'm no longer to be able to work with this designer because of X, I've had to hire this other designer to help complete this project, then we accept that and we finalize the project with them.
And he would know, because they've been there as long as we used to. We don't have as many right now. We have good ones I know, but we used to have several here that our staff had to do different inspections for them than they would anybody else, because they knew of the issues they had for drinking. They knew of the issues they had for just signing off on anything that was put in front of them. And they got paid $600 and they were happy. And that happened a lot back in the time. So being able just anybody to sign it, they'd be contracted out. They'd just be showing up at some of those people as they start to go through. And I'm sure you remember some of those. Yeah, Mason County was bad for that. Yeah, but we're good now, I think. I don't know if any of them like them.
There's it's a definitely a minority of designers that we have issues with. But I know there were some other items you had, Terry, that were, I don't remember them off the top of my head.
I think it's mostly related to how it's gonna relate to the new rules and when
Yeah.
we're gonna be upgrading our own rules.
Mhm.
And could this be all done at once if it really needs to happen?
Mhm. Well, this is not really an update to the rules. I mean, this policy, prior to my time here, this policy was getting changed by EH managers, and it was never coming in front of the Board of Health or going in front of OSAC or anything like that. It was just, I don't like that anymore, let's change it. So I'm trying to go with a reasonable policy and procedure, and not just do things because I want to do them, that's not my job. So as far as the WAC changes go, the WAC changes could affect things, but that's totally separate from this policy. The WAC changes are going to automatically take effect as long as the WAC number is the same. We will have updates to do, like with the management plan. But there's really nothing to say that I can say to, contest your statements as far as, the WAC is gonna change. The
When
WAC
is that going to change?
Yeah, do you know when
It's
And we
it's
don't
been getting
know.
continually
we
pushed
don't
back.
COVID, it
It-
got delayed. Commissioner Jeffries was our representative.
Oh,
And that
It
was
was-
a realtor on that committee.
Yeah, it was supposed to happen in 2017,
Oh,
and then it got delayed and delayed and delayed and delayed. It's supposed to happen every 4 years. It's supposed to be updated. And 5 years with 4-year changes every time, it should be a regular thing. But yeah, there's gonna be changes to the WAC.
And sometimes the only change is around the proprietary technology.
okay.
The basics don't change, but the new technologies, say, a bioreactor is now authorized on small lots or something. That would be a change, but in general, there's not big changes. I haven't seen a big change since 2006.
The most significant changes I can think of that are in this proposed round of WAC updates is really things that would help people develop smaller lots in some cases, and that there's a nitrogen standard now. So they can comply with increased treatment and other technologies they can have integrated into their systems that they install, and that will make it better for them when they're proposing to develop undersized lots. That's the most significant one that I can think of that's gonna really affect people. And that's coming at the same time as they're increasing the minimum lot size by a small amount. But they're kind of doing it at the same time that they're saying, well, there's these other technologies you can use to, if you can control your nitrate production, then you can still develop. That's, as far as, that's what I've seen from the last WAC changes.
Ian, you put Louis to bed.
I have a soothing voice.
Actually, it was me, sorry.
Well, that's what I was like, the public can hear this, it's like they might think one of us is asleep
Yeah.
right now during the meeting.
Um,
It's a dog.
But yeah, WAC changes can happen, and yes, it will be under the old rules. That permit will be good. That's how the WAC is written. The WAC is written to allow that permit to be good regardless of changes to the WAC. So that someone doesn't apply for a permit and then the next day the WAC changes and then they have to get a whole new design and a whole new permit.
Well, thank you for all your hard work on that. I can see the value of it, and why you would do it. Appreciate it.
And I like it that it's not just being, you're coming before the board.
instead of saying, oh, I like it this way.
So is the direction from the board to have Ian take it back to OSAC and have a little bit more discussion there and hammer out some of the details before coming back to us? Does that sound?
I think that's a good idea.
Okay.
All right, their next meeting is in September. I'll get on the agenda for that meeting and then,
Our next meeting's in September too.
yeah, I think ours might be right after, this meeting might be right after that one.
Okay.
Well, as long as it's right after, that
Yeah.
works out good.
Yeah, I think it usually is right after, so.
Yeah, perfect. Any other parting thoughts on this one?
Thanks for answering all the questions.
Okay. Anything else, Ian?
Nope, that's all.
Great, thank you. All right, we'll move on to community health. Melissa.
Hello. We've been very business as usual for the most part, except been very, very busy the last few months, spring, early summer, with contracts closing and then new contracts coming up. So, I've briefed the housing contracts, we have some TST contracts. I have to give a really big kudos to our housing team, Todd and Haley. We've three worked really closely as a team to really review the language in our contracts, as well as standardize the way that we manage all of them across all our different agencies. So I'm really excited about that, and I'm also really excited to piggyback on Dave presenting earlier about the grant management software. I really hope it's something that we can use. There's so much good work to do in community health that, the administrative burden sometimes of managing things takes up a lot of time. So I'm really hopeful. We have our demo tomorrow, and TJ from IT will be on there. So hopefully it's something that's feasible. A question that I actually had for the board is, I do the written report in the packet, and I'm wondering, is the information helpful, or is there other information that you're interested in that I could present more on? I'm open to feedback.
I appreciated it. I like how you, it's easy to understand. And to me, it was interesting. I liked seeing the needle, where was it? The needle exchange too.
The mobile outreach.
Yeah.
Yeah,
Mhm.
the visuals.
Right. Seeing the actual numbers, I think was.
Try to be a little bit more visual, so it's not a lot of reading. There was a lot of writing in this one, but as I mentioned, a lot of business as usual. So maternal child health, very excited about getting a little bit of additional funding through September. The rationale around the additional dollars we requested was really intentional, just to ensure that our nurse, Elizabeth, who does the children with special health care needs, those programs, can at least dedicate her full FTE to that and catch up on a backlog that she had during COVID. Because she was one of two nurses during COVID, and a lot of that kind of just her caseload built up. So we're hoping that she can kind of catch up on that through the summer. And we also got a no-cost extension for the Rural Communities Opioid Response Program, RCOR. That just really kind of helps us continuity of programming in the jail. So we have the jail reentry program, that's mostly that, and a little bit of case management as well. So Dr. Gardner and Dave mentioned that we applied for this endemic grant. We won't know, I don't know actually when we're supposed to find out about it, but the funding doesn't start till January. So hopefully we'll see a little bit of a change in the types of things that we present, at least quantitatively, as we expand some of those services. But that's kind of.
I have one question. Did they find out where the high level of lead?
Yes, so Elizabeth has a client, I believe it's a 3-year-old, who has a really, really high level of lead. And I think right now they're thinking it might be environmental, so maybe the paint in the household, but I don't think they've determined it yet.
Yeah, I was just curious, because I haven't seen that for a while.
Remember, there still is the lead paint or the
Yeah.
lead pipe in some of our residents around here.
And some people cast bullets, some people cast, fishing weights.
Yeah.
And that's where I've seen, it was fishing weights was the last one I saw.
Right.
Interesting.
Yeah.
Some areas of water have a high lead just because of
Yeah.
that.
Right.
After the meeting, if you have time, I'd love 2 minutes of your time regarding housing. Sure. Thank you.
Kind of piggyback on, we also have a program that we have used in the past, Insight Vision, that we are standing that back up again. It hasn't been used since 2017, we've been paying license fees on it, haven't used it, and we were sharing it with, 5 counties? 4 counties, I think.
I thought it was 5.
It was 4 or 5 counties, and they haven't used it since 2017, so I said, well, we'll pay for their licenses and we'll use it. And we've collected that back to us. And what that will do is allow us to have key performance indicators for every program. So I dislike when people ask me, well, are we making a difference? I can say, well, we have this program. Well, having a program is not an indicator of are we successful. So this will allow us to take our strategic plan and those work plans, put them into that and actually track start
it-
counting things, and accounting for things, so. So there's some new software to this staff because almost nobody was here back in the day when we used it before,
Yeah,
so.
I think Kim Quint was the one
Yeah.
that started that,
Right,
yeah.
way back then, so, yeah, but I think between the two, between the grant software and then Insight Vision, will give us a way to quantify to the board and to ourselves, are we making a difference in smoking? Is our money being spent in a way that's actually making a difference? If it's not, then how do we address that? Do we change it? Do we do something different? Just gives more information to be able to make rational decisions.
Anything else, Melissa? Okay, very good. Okay, I think that moves us on to good of the order. Any updates from the board, or? Okay, and that's, I think, public comment. Any additional public comment?
Yes, I do.
Okay.
Dave, how do we find out about mini grants and who's eligible for them?
So mini grants, we set aside back in May $10,000, and we've got about 4 of it spoken for. And basically, it's so simple. So just get a hold of me,
Okay.
and I'll get you the form on it, and then Ian and Melissa and I review them. Basically, if the project meets our mission statement, we can make it fit.
Okay, this would be on teacher and student mental health. And it's a full-day training that would happen this
Yeah.
fall. We already have our educator, we can offer the CEUs. We just need some help
Yeah.
paying for the speakers.
So on these mini grants, what we've done is we've set a limit of $1,000 each, and all of them that come in so far have been over that. So their acceptance letters is saying, okay, but we're only funding 1,000. So,
That would cover exactly what we're missing right now.
so yeah, just shoot me an email and we'll get you the application.
Great. And 501c3 is fine, and then just in the mission? Okay, perfect.
Yeah, there's a form. It's a 2-page thing. It's really easy. So.
Great. Thank you.
What are you guys doing these days? Now that you're still in it, you've expanded, and contracted over the years. What are you doing now, exactly?
Same thing. I spend a lot of time on workforce development, making sure that our companies have what they need for their workforce. I have been working on water quality problems, serious ones. We have potentially 3 downgrades that Ian has briefed you on. I'm trying to figure out how that's gonna impact, how people are gonna need to shift or not shift product, looking for those next things. Education to homeowners that think they have a problem, but aren't quite sure. Starting new farms, permitting.
You ever work with anybody as intermediary for grants and stuff on working with septics or loans?
I help people apply for those and get that through Craft 3 and make sure that they understand why their system's failing and not.
I think that's one of the main ones where we used to utilize you a lot, and I'd love to see our county go back to marketing that a little bit on our website so people could have somebody to reach out to. They reach out to me and I try to move them around, but the truth is we should have it on our website giving direct.
Well, Ian's team brought in WSU just last month and had a workshop up at Public Works. And there were quite a few people there that some obviously had some problems and some that didn't have some problems. And they were there to learn, and I think Ian had his on-site inspector, 2 on-site folks there. And they were able to answer questions after the fact. I think people are still scared about septics. Unfortunately, the downgrades do help us get the word out a little bit more, and it makes people nervous thinking, oh, maybe I have one. And so looking at that sort of thing. So anytime we can get water quality into the news, it's helpful, and I know Ian's team is working for the Clean Water District on the report card that's gonna be coming out later this summer, early this fall, and that'll drive a lot of folks as well. So yeah, I mean, obviously there's more than just a few people can do. It takes all of us to do it and to find the person or the person to find you when it's the right time. Not everybody's ready at the time we're ready to deliver the service.
That's actually what I'm saying, so
Yeah.
if you need me in any way to get that out there. Up in my area, we have a lot of people, they can't afford to do these things, and they'd rather hide it than fix it, because they don't know what their options are, and the more we can do that, get that out to them, be
Yeah.
beneficial.
And we have to work as a team, else we're not gonna combat this at all. And, you know, if it's picking up pet waste, and that's the first thing they do, and that's the gateway to, hey, I've got a septic system problem that I was afraid to tell you about, I'm willing to talk about pet waste to get to that septic or whatever it is that's causing those problems. So figuring that out, I think, is what we need to do.
You always have been willing to work with anyone, always.
It's multifaceted. There's a lot of fingers, right?
When I
And
met
so
her,
making those
she came and let
connections.
us know at the Port of Allen that our bird poop was causing issues after
Well,
she,
no, the question
after
was
she did.
whether it was or not,
Yeah.
and how we could mitigate that.
Yeah, and the work she put in for the Port Allen back then, and what we found out was like, okay, we never would have thought of anything like that. So, I have great respect for her from all that
Well,
time
and
ago.
Ian's team is still working on that area, so,
Yeah,
you know,
we've had mixed results with the bird waste issue. There's like fishing line, and just string up on
Yep.
the rails, but the fishing line gets vandalized, and Port of Allen says, we're not just gonna keep sticking it up when it gets cut off all the time. But we've put up, bird feeding signs to ask people not to feed the birds there at the Port of Allen. It's still an issue though.
Well, it always will be, but we didn't even know it was an issue until she came in.
and the port has continued the high grass along the shoreline, so they're not having the Canadian goose issue.
Yeah.
That was one of the big things, and I remember Commissioner Netherland going, and the maintenance folks going, what, no, we're cutting it all down, it's a fire hazard. No, you have to understand that the birds don't like that. They're not gonna go on the lawn, they're not gonna roost there, so, yeah. Yeah. Now, there's a lot of stuff, and Ian, I'm really excited to have 2 back in water quality. Congratulations. And I think this will be great, and looking forward to meeting them soon.
Excellent. Any other public comment? Okay. Any public comment on Zoom? Does not appear that we have any members of the public on Zoom. So with that, I would entertain a motion to adjourn.
I so move.
I second.
Moved and seconded that we adjourn. All those in favor say aye.
Aye.
All opposed. We are adjourned. Everybody in 2 months?
Bye, everybody, thank you.
Thank you, Carrie.
It didn't watch radar, to fix everything.